My mother is already 90 years old. She has a very advanced spinal osteochondrosis with kyphosis. Doctors know that this is a curvature of the spine, which is quite painful. She couldn't, for example, straighten her back completely. After about 2 weeks of using the device, the Deta Rhythm, for the first time she was able to straighten her back painlessly. And since then, for 2 years now, she has had both devices and never lets them go.
My daughter was constantly suffering from herpes. We tried all the methods of traditional medicine. We used everything imaginable, all sorts of medications. Nevertheless, every month she would get herpes on her lips. She sat with the device for 3 hours. The herpes on her lips started to dry up. The next day, another hour. It's been almost a year now. After this treatment, the herpes on her lips hasn't appeared again.
One of my very closest relatives was unfortunately diagnosed with a serious case of cancer of the descending colon, and subsequently, surgery was successfully performed. But unfortunately, on the 5th day, the anastomosis that was performed after removing a certain part of the descending colon became non-viable, leading to severe fecal peritonitis. Subsequently, a few days later, there was additional bleeding, and this patient, already 72 years old, had to undergo 3 relaparotomies and a reconstructive surgery with the proximal part of the intestine brought out to the anterior abdominal wall. There was 1 clinical death, resuscitation in the intensive care unit, and so on, revival, and only after the use of With the use of the Deta app and Deta RTM devices, that is antibacterial and aimed at detoxifying the body, improving blood circulation, microcirculation, and normalizing the acid-base balance, it led to the patient's temperature normalizing within 3 days. And after 10 days, I was already able to take him home where further care was provided. I had to remove the stitches at home. And the second case concerns my own brother. There he underwent several different surgical interventions, but the most important thing was that there was a focus and ischemic lesion in the diencephalic region of the brain. And after the exact and precise diagnosis was firmly established, truly thanks to the correct and meticulously applied program using Deta Rhythm, I literally didn't even recognize my own dear brother because he simply couldn't get up, couldn't walk, or even take a simple stroll. He was utterly unable to do anything at all. It was incredibly touching and deeply moving. And a week later, this brother of mine who lives in Tallinn, after 10 days, I already sent him by plane back to Tallinn so that he could continue essentially using these devices.
A young man comes up about 30 years old. I noticed that he had a huge lymph node on his neck, the size of a boiled egg. I asked, "What is that lump?" "Yes," he said. "It hasn't gone away for 3 months now." He said, "I've been treated with antibiotics for over a month. We've tried everything, but nothing works." "Well, all right, I'll give it a try. I can't promise anything, but I'll try." I put on the device, set it up, and selected Streptococcus. Within 3 days, his lymph node had completely disappeared. It was just a simple lymphadenitis. Honestly, I really should have recorded it, but I didn't record it. But it happened right before our eyes in just 3 days. You used a chicken egg, and it went away.
I got a very good result. Using the devices for type 2 diabetes. Type 2 diabetes. The man, also 70 years old, has been suffering for many years. To lower his blood sugar, he was taking all sorts of oral medications. When I first met him and set up a specific diabetes program for him, within just 1 week, his blood sugar levels dramatically dropped from a concerning 15 milligrams to a much healthier 7 milligrams.
There are patients who were scheduled for surgery, well, for leg amputation because of ulcers. The risk of gangrene was already appearing, and so on. We managed to cure it, restore everything to normal with Deta Rhythm, and reestablish blood circulation. This is without a doubt new technology in medicine.
The very first results confirmed all my scientific expectations, and we started getting such outcomes in difficult-to-treat areas and diseases such as cerebral palsy in children and low-pressure glaucoma. When many people try unsuccessfully to lower their high numbers of blood sugar, we reduce the numbers in diabetes and completely stop using medications, gradually bringing the person back to normal. As for diseases affecting men, well, prostatitis, let's put it this way. When a person has already refused any help and is only being offered surgery,
We were able to reverse this process, dissolve the calcifications, and the person can live a calm and normal life.
Since I am a rheumatologist, people come to me with joint complaints, mainly with reactive arthritis, deforming osteoarthritis, rheumatoid arthritis. In other words, with these conditions, the device has proven itself well. It allowed us to reduce the dosage of medications. A positive effect, including pain relief, was achieved more quickly and joint function improved. And naturally, the person felt better and could recover faster and return to their activities. Some kind of improvement, the antiparasitic device. It was also used in many cases, and as a rule, the effect was 100%, especially with chlamydial urogenital infections. Reactive arthritis, the treatment duration was reduced by half. And there were no relapses, which is the most interesting part. Usually with antibiotic therapy, relapses are quite common, and treatment is not always effective at all.
When it comes to gallstone disease, there are a lot of cases. And considering that we live in an endemic region, with giardiasis we start treating the giardia, begin using the program for the gallbladder, and the pain goes away. Bile flow normalizes, and in the end, even the stones dissolve. There are already hundreds of such cases. As of today, it is used to treat a very wide range of diseases. I started the diagnostics with myself. I discovered a lot of interesting things. Constant chronic fatigue, constant malaise, all of that was there. I programmed the device, and now, as they say, I'm running and flying because I got rid of those problems, which I used to have, and that's why I confidently recommend this device to people.
After conducting comprehensive follow-up studies and thorough investigations, it was conclusively determined that the overall effectiveness for patients afflicted with various parasitic diseases was remarkably high, reaching approximately 96%. As for the effectiveness against infectious diseases, it was practically 100%.
Indeed, the equipment works. And the uniqueness of this equipment lies in the fact that there are no diseases that cannot be cured. This is what has come to replace antibiotics in many cases in life. These devices have proven themselves very well when working with patients with diabetes.
If you do proper prevention, then the disease, generally speaking, should occur much less frequently. Ideally, it shouldn't occur at all.
All of medicine is built on symptomatology. But here, with a single device, we can encompass the unimaginable, practically the entire body. Because 13-10-13 programs of the therapeutic device cover various organs and systems. We forget that the body is an integrated system, and therefore by approaching the body from all sides we can achieve the very result that we don't get when we treat individual organs and tissues. Well, in my practice I have both oncology patients and a young man with diabetes. He had cataracts diagnosed a year ago and they insisted on urgent surgery, but his cataracts completely resolved. Cataracts.
When I talk about the field of dentistry and we say that periodontitis, a serious gum disease, can indeed be treated, many dental doctors just smile. They often give me mysterious looks and then say, that's simply impossible. Because it just fundamentally can't be, even when you take the comprehensive evidence base and show it to the doctor, here's the actual start of the treatment. Here are the intermediate results, and here is the end of a certain course. The doctor looks and says, I see it, but I don't believe it. It's quite hard to break through that.
This is one of the few technologies that accumulate such a range of advantages that I even find it hard to name any other technology that combines so many essential qualities at once. And this is a technology, the technology of the future, for every family, for every person.
The prolonged course of chronic diseases gradually develops into more complex illnesses, up to and including cancer. Accordingly, the task of treating chronic diseases is now a top priority worldwide. And it is precisely in the treatment of chronic diseases that the Deta series devices help speed up the recovery process. And in particular, antibiotics are generally not suitable for treating chronic infections. It is specifically antipathology. The Deta parasitic device, as a rule, helps to eliminate these infections in almost 100% of cases. I
don't see what can be done without these devices. They are literally useful in any field, even in surgery. Including for recovery, healing, regeneration, they will find their place there as well, ultimately. But now I simply can't imagine therapy without this device at all.
There isn't a single medication that has a good effect on all organs. For example, if we treat the lungs, it's not desirable for the heart. If we treat the heart, with this blocker, it's not good for lung diseases. But with this device, you use it for the heart. There's no harm, only improvement, and the same goes for the lungs. So it turns out that we don't damage any organ.
It's unclear why you need to take medications by the kilogram when you can get by with just a few sessions. Moreover, you can even choose which combination to use in what sequence, at what time, and at what intensity. I honestly don't understand how one can get by without this in life.
Can this one device really replace our entire medicine cabinet? We always have to consider not only effectiveness but also ease of use. This is without a doubt convenient to use. And of course, the significant and often prohibitive cost of medical treatment. Our valued patients, especially those in the vulnerable pensioner group, simply cannot afford these incredibly expensive and often life-saving treatments. I must emphasize this critical point.
Use it myself. I use it simply for prevention. The cleansing program, the detox program, the active protection program, that is, even if nothing hurts, I use it to improve my overall well-being.